Good afternoon. There is good news to share in Boston's fight against COVID-19. According to the most recent data, 58% of Boston residents have gotten at least one dose of a COVID-19 vaccine. We are making progress all across our city. From Roxbury to Rosendale, East Boston to West Roxbury, Boston residents are getting their shot at rates that outpace the rest of the country. We are doing this work together. Coordinating with the state, the City of Boston is implementing a mix of strategies that are working for our communities. We are creating equitable vaccine access in our city with a four-part approach: mass vaccination sites that deliver doses to thousands, community health centers that are familiar and trusted, targeted clinics for frontline workers, and mobile units that bring the vaccine right into our neighborhoods. As mayor, I have led a COVID-19 response that is driven by data. Chief Martinez will share more details about the data we are tracking. I want everyone to know that COVID data trends in Boston continue to move in the right direction. We have the lowest numbers of active cases since we began tracking over a year ago in April of 2020. This is because of the efforts Boston residents have made together. I want to express my deep gratitude to the people of our city. Because of this progress, I am making the decision to align with the Commonwealth of Massachusetts and lift the COVID restrictions on May 29th. But let me be clear, our battle against COVID is not over. Reopening our city will only work if we all continue to do our part to fight the pandemic. I want to congratulate the more than 391,000 Boston residents who have already been vaccinated with at least one shot. Even with our mask on, we can breathe easier knowing we are protected and that we're protecting others. We know what works in Boston. We have created a culture of wearing masks, washing our hands, and keeping our distance that keeps us safe. Let's keep it up. We will only get through this pandemic together. As we welcome the reopening of our city and get Boston back to work, we can't leave our neighborhoods behind. I want to make sure Boston's recovery, reopening, and renewal is enjoyed by everyone in our city. I am doubling down on our efforts to make vaccines more equitable in Boston. There is more work to do, especially in areas that have been hardest hit by the pandemic. The fact is, some of our communities that face the highest rates of COVID illnesses and deaths also have the lowest rates of vaccination. Only about 30% of our Black and brown neighbors are vaccinated, and we must do better. Today, I am doubling our city's investment in the Vaccine Equity Grant Initiative. The initiative will now provide $3 million in total grants to neighborhood groups working on the ground, door to door, to bring vaccines to the communities that need it most. Through the Vaccine Equity Grant Initiative, neighbors are reaching out to other neighbors to answer questions, provide translation, and arrange transportation for life-saving vaccines. I'm very proud of the progress we have made in Boston in our fight against COVID-19. Together, we are proving that vaccines and masks work. Masks are still the simplest way to protect vulnerable neighbors. In Boston, it is easier than ever to book an appointment. And in many locations, you can just show up without an appointment to get your shot. We've been fighting COVID-19 for over a year. After all of this time of sacrifice and fear, I think the best incentive to get the vaccine is to protect ourselves, our loved ones, and our communities from COVID. Vaccines give us the chance to create a safer and more hopeful future for Boston. In closing, this is Emergency Medical Service Week, and I'd like to thank Boston EMS for the life-saving work they do every day and for the hands-on work they've done throughout this pandemic to keep our residents safe, including standing up mobile vaccination clinics. Now I will turn it over to Chief Marty Martinez, who will share details on the data trends in our city and all the ways that Boston residents can access COVID vaccines. Thank you. Chief Martinez.
Thank you, Mayor. The city continues to make progress in our fight against COVID, and the data shows us that Bostonians are doing their part. As the Mayor mentioned, we're making progress. As of May 11th, we are only seeing an average of 63 cases per day in the city. Our positivity is down to 2.1%, with no neighborhood over 4.3%. We've seen an ongoing decrease over the last several months. Our hospital metrics have also gone down. We have less than 65 COVID-positive patients in our Boston hospitals, and we have not seen these low numbers in over a year. It is clear that vaccines are working to get people from developing serious cases of COVID and greatly decreasing the spread of the virus. But while the data shows us it's working, as the Mayor said, we must double down on those efforts. Right now in Boston, 293,000 Bostonians have been fully vaccinated, about 43% as of May 11th, and we know that number is over 300,000 by now. Our residents are making tremendous progress, but we have more work to do. In our communities of color, we still see rates behind that of white Bostonians, and we need to continue our on-the-ground outreach and mobilization to ensure there's access and awareness of its importance, and that all barriers are broken down to ensure our hardest-hit communities get vaccinated. The city will continue our equitable approach to vaccines to ensure that we can keep making progress in every neighborhood and in every community. As this reopening continues, Health and Human Services and the Health Commission stand ready to work to make sure that we're continuing this progress so that all Bostonians can benefit from this reopening and keep us all safe as we work to finish this fight against COVID. The progress we've made is working, and it's important that we have this recovery, but it's important that we continue to do all the things we've done that have gotten us here. Now with that, I'll pass it back to the Mayor to take questions.
Yes. The question was around the timing of reopening and the data, and it is always data informed. So here in Boston, we have more than a month of the data showing that cases are low and continue to be low over time. And so last Monday I was here and I said it to everyone here that I had asked my Chief of Economic Development and my Chief of Public Health to look at our reopening plan. And so we are being informed by the data, and the data suggests that we can. But as I said today, we have more work to do in making sure that we are getting the vaccine out to every neighborhood, and that we are doubling down our efforts to ensure that every Bostonian who wants a vaccine can get one. For me, no. I mean, I have it off here so that you can hear me, and because you're far away, but no. I was out this weekend, and it was so good to see the number of Boston residents who are continuing to mask up, despite that the weather is great and people are out enjoying and that they're hearing different messages from the feds. People in Boston are still protecting themselves, and I think that is the best course of action. Yes. So I will simply say this. The hearing that I scheduled for Commissioner White was to remove him as commissioner. He has now filed an injunction with the courts, and until we hear that ruling, we won't have much more to share on that. Yes. I'm sorry, I can't hear you, sir.
I want to ask you two things. One about the virus, COVID, and also about Dennis White. On COVID, I want to ask you about the message getting out to the communities that are so far being resistant and hesitant to get the vaccine. Is it more difficult now to make that case for them because the numbers are coming down without them getting a vaccine? They should continue to get it. What is the message for them?
The question was about hesitancy in some of our neighborhoods and an incentive to get the vaccine. The best incentive is to protect ourselves against COVID-19. Unfortunately, we have seen throughout this pandemic disproportionate impact in certain communities. The Black and Latino community has had disproportionate impact in terms of cases as well as deaths. And this is why we are doubling down our efforts to get more resources out into our neighborhoods, to reach people where they are, particularly in the hardest hit neighborhoods and the vulnerable populations. It is important that we continue to do what works in Boston and that we not let our foot off the gas when it comes to beating this pandemic. Together we are doing that, not just the residents of Boston, but all of the many partners who have been recipients of the funding that I gave initially, that original $1.5 million. We're doubling that effort. We're doubling that money so that we can reach some of the hardest hit communities. We've got to keep it up, but there's a lot to celebrate today. The numbers are going in the right direction. We need to keep them going in the right direction, and we need to do everything we can to ensure everyone in Boston can get access to the vaccine and actually gets vaccinated. That is how we ensure our economic recovery works, because it is so tied to our public health recovery. We have to get folks vaccinated.
The city has not yet filed a response to the request for a PRO. When do you expect that to happen? And what is your thinking as far as when you expect to be able to move past this and have a permanent commissioner for Boston?
And I'll try to get you and Danny in here together. Again, the investigation, the report has been released. I think everyone here has seen it, and I believe it speaks for itself. I am scheduling a hearing as soon as the court allows to remove this current commissioner and to appoint a new commissioner so that we can move our city forward. Until we get a ruling, which we expect will happen hopefully sometime this week, we'll have to wait and see on that. But my intent is to move the police department forward and ultimately move our city forward. There is a lot of work that we have to do in our city, and we can't have the officers who are doing good work every day wonder that if they speak up, that somehow there'll be some retaliation. We saw that there was a clear culture of fear and silence with this report, and we can't have that continue, nor can we have a culture by which victims of domestic violence or sexual assault feel like they can't go to the police for help. So again, we'll have more to share once the court makes its ruling, and I appreciate everyone for being here. Thank you very much.